Depression is more than just feeling sad or down. It is a serious medical condition that affects thoughts, feelings, and behaviors. While everyone experiences sadness occasionally, depression is persistent and overwhelming. It significantly impacts daily life, making it difficult to work, study, sleep, eat, or enjoy once pleasurable activities. Depression is not a sign of weakness or a character flaw. It's crucial to remember that depression is a real illness with real causes, just like any other medical condition. It's essential to differentiate between sadness, a normal human emotion, and clinical depression. Sadness is temporary, often triggered by specific events, and fades with time. Depression, however, lingers for weeks, months, or even years and may not have a clear trigger. It's like being stuck in a deep, dark hole with no escape in sight. Depression manifests differently in each individual, but certain common symptoms serve as red flags. One key symptom is a persistent low mood or feeling of emptiness, often accompanied by a loss of interest or pleasure in activities once enjoyed. Changes in appetite and sleep patterns are also common. Some individuals may experience increased appetite and sleep, seeking solace in food and rest, while others may find themselves unable to eat or sleep properly. Feelings of worthlessness, guilt, and hopelessness are frequent companions of depression, leading to a negative self-image and a bleak outlook on the future. Difficulty concentrating, remembering details, or making decisions are also common, impacting work, studies, and daily tasks. Depression is not all in your head in the dismissive sense. It reflects real physical changes within the brain. Research reveals that individuals with depression often have smaller frontal lobes and hippocampal volumes, regions responsible for emotional regulation, memory, and learning. Neurotransmitters, chemical messengers in the brain, also play a crucial role. Depression is associated with imbalances in serotonin, norepinephrine, and dopamine, neurotransmitters involved in mood, sleep, pleasure, and motivation. Furthermore, depression disrupts the delicate balance of hormones. Cortisol, the stress hormone, is often elevated in individuals with depression, contributing to anxiety, sleep disturbances, and other physical symptoms. Thyroid hormone imbalances are also common, further impacting mood, energy levels, and overall well-being. Section 4. Nature and Nurture, Unveiling the Causes. The causes of depression are complex and multifaceted, involving an intricate interplay of genetic predisposition and environmental factors. While there's no single gene that causes depression, having a family history of the condition can increase an individual's susceptibility. Life experiences, particularly stressful or traumatic ones, can also play a significant role. Childhood trauma, abuse, neglect, the loss of a loved one, job loss, financial difficulties, and chronic illness can all contribute to the development of depression. It's essential to remember that depression is often the result of a combination of factors rather than a single isolated cause. Understanding this complex interplay is crucial for developing effective treatment strategies tailored to individual needs. Section 5. Breaking the silence, the importance of seeking timely help. Despite the prevalence of depression, many individuals suffer in silence, delaying seeking help for years. The stigma surrounding mental health often prevents individuals from acknowledging their struggles and reaching out for support. On average, it takes over 10 years from the onset of symptoms for someone with a mental illness to seek professional help. This delay in treatment can have significant consequences, allowing the condition to worsen, increasing the risk of complications and impacting various aspects of life. Seeking help early is crucial for effective management of depression and improving long-term outcomes. Recognizing the signs of depression in yourself or someone you care about and encouraging them to seek professional help is vital. Remember, depression is treatable, and with the right support, recovery is possible. Section 6. Navigating treatment paths to recovery. Treating depression typically involves a multifaceted approach tailored to the individual's specific needs and severity of symptoms. Medications such as antidepressants are often prescribed to help regulate brain chemistry and alleviate symptoms like low mood, sleep disturbances, and appetite changes. Psychotherapy, also known as talk therapy, plays a crucial role in understanding the underlying causes of depression, developing coping mechanisms and fostering healthier thought patterns and behaviors. Cognitive behavioral therapy, or CBT, and interpersonal therapy, or IPT, are two commonly used and effective forms of therapy. In some cases, electroconvulsive therapy, or ECT, may be recommended for individuals with severe depression who haven't responded to other treatments. ECT involves inducing a brief seizure while the patient is under anesthesia, and it can be highly effective in alleviating severe depressive symptoms. Section 7. Extending a helping hand, supporting loved ones and reducing stigma. Supporting a loved one struggling with depression requires patience, understanding, and empathy. Educate yourself about depression to better comprehend their experiences and avoid judgment or dismissive comments. Encourage them to seek professional help and offer practical support, such as researching therapists, scheduling appointments, or accompanying them to appointments. Remember, even small gestures of kindness and support can make a significant difference. Finally, challenge the stigma surrounding mental illness by speaking openly about depression, sharing your own experiences if comfortable, and advocating for mental health awareness and access to care. By breaking down the barriers of silence and shame, we can create a more supportive and understanding environment for individuals struggling with depression.